All righty. So, Path and Lab. This is a fairly large section. So we may not cover every single little section as far as Path and Lab is concerned tonight. But this has got a pretty decent combination of types of questions that you might see and things along those lines. So let's go ahead and start off with number one. So we have a patient presents with right upper quadrant pain, nausea, and other symptoms of liver disease, as well as complaints of decreased urination. And her physician orders an albumin, bilirubin, both total and direct, alkaline phosphatase, total protein, alanine aminotransferase, aspartate aminotransferase, and creatinine. So what CPT code or codes should we report? So when we're talking about lab codes, okay, so not necessarily path and lab section, but labs where they're ordering specific labs, doing blood draws, and then testing them. When you have a lot of labs like this one, you see that there's all of these here, right? You do have those disease-oriented panels that are at the very beginning of the path and lab section, right?
Mm-hmm.
So when you have these panels, the first thing that I always do is go to that panel, the code that represents the panel within your multiple choice options, and see if everything is included. If it's not, then we know we can either report things additional or we have to break everything out. Okay. So for this one, I want to go directly to the 80076. So our 80076, that is your hepatic function panel, and it must include the following. It has to include albumin, which we've got. It has to include bilirubin. You've got a total and direct underneath there. So that includes that. It has to include alkaline phosphatase. It has to include protein total or total protein. It has to include transferase alanine amino, and then it has to include the transferase aspartate amino. Okay. So we know that 80076 has been met. So we're not going to report everything separately, and we have enough to report 80076. Okay.
Mm-hmm.
But the one thing that we have to think about is we have this creatinine as well that has to be reported. Oh, that is not what I meant to do. I meant to use green. Okay. So if we have an additional test that can be reported, we will not use a 22 modifier because we have to report what that additional test is because that's all going to be dependent on what the test is that's reported. And then we know that we have to report something else in addition to the 80076 because the creatinine is not included, right? So
Mm-hmm.
without even going to choose or go to look at the 82565 to see if it is the creatinine, we know automatically based off the process of elimination that we're not going to report everything separate. We're not supposed to use a 22, but we do have to report something in addition. Okay.
Yep.
Any questions on that one? I know a lot of people will see kind of these labs and get a little confused and get overwhelmed when you have one question that has 7 or 8 different tests. Like you're going to feel like you have to go look at each one of those individually. But like I said, when you have a lot of these and you have a single code, this 99% of the time, that single code is going to represent a panel. And you just have to make sure that everything's included in the panel. And then if there's anything separate that we can report, just make sure that you report that separately. Okay. All right. Number 2, patient has a cytopathology study performed by fine needle aspiration. The results are quite unusual and they are considered moderately complex. The slides, as well as a copy of pertinent information from the patient's record, are sent to another cytopathologist for consultation. The consulting pathologist reviews the slides and reviews the patient's chart material, and a report is sent back to the original pathologist with the findings. And the medical decision making is going to be considered moderate. Okay. So right off the bat, we can eliminate one code because we know that this is a pathology consultation, not a consultation in an office setting. So we can automatically eliminate letter B because we have to know that we're doing a pathology consult, not an office visit consult. Okay. Next, we have two that are very close to each other, right? So let's go look at the 80504 and the 80503. And let's go take a look at those. So 80504 and 80503 are pathology clinical consultations, and it's just a matter of our amount of medical decision making that we have. So again, this is kind of going back a little bit on consultations, but remember we have three components that we have to meet for consultations, whether they are clinical pathology consultations, whether they're office visit consultations, whatever they might be. We have to meet those three R's. So we have to have a request from another provider or an appropriate source. So here they are basically them sending this over from this other cytopathologist. That is our request. Okay. And then here, they are sent to another pathologist for the request. So that is our first R. The second R is they have to render the service. So they are reviewing the slides and then reviewing the patient's chart material. And then the third R is they have to respond with that written report. So they've also written back or responded with that written report with the findings. Okay. So I just wanted to kind of touch on that real quick. Whenever you're doing your exam, they might throw in a consultation from and this could even be in the evaluation and management section. But if they're getting if they were requested by the patient, that's not going to be considered a consultation. A second opinion from the patient is just going to be billed with a regular office visit type scenario. Okay. So just kind of keep that in mind. I always like to kind of touch base on that for just a second. Okay. So we have met the three R's. We have the request, we have rendered the service, and then we have a written report that is sent back. So we do have a medical decision making of moderate complexity. So is it going to be 80503 or 80504?
The 4.
Yep, it's going to be our 80504. Yep, because that's our moderate medical decision making. Okay. Any questions on that one? Okay. Number 3, we have a pregnant patient is tested for serologic blood type and Rh factor. So what CPT code or codes should we report? So in this one, we have two options that have the same code. So let's go look at 86900. Eight six nine hundred That is for blood typing serologic ABO. Does that sound like what we did?
Yes.
Okay. So we did do the serologic blood type for ABO. Do we need to report something else in addition to the 86900, or should we only report the 86900?
You need the 86901 for the RH factor.
Yep, because we did the RH factor as well. So that is a different component that we have to report. Yep.
No.
A lot of people will think, oh, well, I'm A positive, right? And they think that, oh, that's just a single test. But no, you have to run two tests. You're going to have one that's going to tell you your type A, AB, B, or O. And then you have a second that's going to tell you whether or not your RH factor is positive or negative. Okay. Any questions on that one? Okay. Number 4, a 35-year-old type 2 diabetic is feeling weak. The physician performs a stat glucose test in which a finger stick is done, placing the drop of blood on a reagent strip. The test indicates that the patient is hypoglycemic. The physician gives the patient some glucose supplements and then performs another stat glucose test using the same lab test as before, 30 minutes later. The second test shows that the glucose levels have returned to normal. And so how are we going to report the lab tests themselves? So we have two codes essentially, right? A and B have 82947, and then C and D have 82948. So let's go look at those. Okay. So 82947 is glucose quantitative blood, except for a reagent strip. And then 82948 is the glucose blood reagent strip. So which one are we going to use? The 47 or the 48?
48.
Yep. Because we've got the finger stick placing the drop on the reagent strip. So we're going to use the 48. Okay.
What would be what's the difference between that? Because you got quantitative for the 47.
Quantitative is going to be like where they take it and they put it through a centrifuge and then it responds back with a specific number.
Okay.
Whereas your reagent strip is going to be the one that they just put in the little blood machine, the glucose machine that typically your diabetics will test your glucose on. That's what your reagent strip is going to be.
Okay.
Okay. So now the question begs, do we need a 91 on the second or do we need a 76?
So 91.
90. Yeah, 91.
Yep. 76 is going to be on surgical procedures type thing, whereas your 91 is going to be on that repeat lab test. Yep. So we're going to use the 91. So letter C is going to be our answer. So one of the other things that you could have done is you could have seen that you have two 76s and then ruled out B and D first and then found your CPT code. Or you can go straight to your CPT code, rule out 2, and then figure out which modifier. So just because I went to the CPT code first doesn't mean that you can't do modifier, rule out with the modifier first. It's just whichever one your brain wants to process the information on. Okay. Any questions on that? Okay. Number 5, patient arrives at the ED and it appears that the patient has been suffering from periods of disorientation, persistent stomachache, fatigue over the last several months, but the persistent patch of dark skin that appeared on the patient's chest has prompted his visit. The treating ED physician orders a stimulation panel for ACTH, consisting of 2 cortisol injections, 60 minutes apart. The blood tests reveal ACTH levels are at 300 mmol, and they diagnose the patient with adrenal insufficiency. So for this one, I have 2 that have 82533. Okay. So let's go look at that code and see if that matches our procedure or our lab test. So 82533 is for cortisol total. So are we testing the cortisol?
No.
Right. We have injected cortisol, but we're not testing the cortisol level. So we want to rule out A and D because we're not testing for the cortisol. We're doing the ACTH stimulation panel. Okay. So now let's go look at the 80400 and the 80408 because those are going to be pretty close to each other.
It's the 400.
Yep. The ACT8 or I'm sorry, the 80400 is the ACTH stimulation panel for the adrenal insufficiency. Yep. So we did that stimulation for ACTH. And then it does consist of those 2 cortisol injections, which are a requirement to report that ACTH. So had they said they only did 1 cortisol injection, we would not be able to report the ACTH stimulation panel because you have to have 2 in order for that code to be supported. Does that part make sense?
Yes.
Okay. I know that can be a little confusing when you see, the numbers underneath it type thing. Okay. Any questions on that one? Okay. Number 6, we have a patient will be undergoing a transplant and they need an HLA tissue typing with DR, DQ, multiple antigen, and lymphocyte mixed culture. So for this one, you can do this one a couple of different ways. There are 3 options that have 86817. Okay. But we're only going to potentially rule out 1, right? But we do have 2 86821. So either way, we're going to rule out 2. So what I would do is I would go to the 86821 and decide if that is a code that I need or if I don't need it. And then either way, I've got 2 of my codes. I've got 2 options left. So looking at 86821, that is HLA typing, lymphocyte culture mixed, or MLC. Is that what we're looking at?
Yes.
Yep. So we did do the lymphocyte mixed culture. Okay. So we are ruling out letters A and D because we know that we have to have that 86821. And then we just need to decide, is it 86816 or 86817?
The 817 because it's got multi-out antigens.
Yep, it's the DRDQ multiple antigens. Yep. Yep. That makes sense to everybody? Any questions on that one?
The only thing I don't understand is that 26 modifier.
They just put that on there to see if you're just going, oh, well, this is the test, so I'm just going to do a 26. Yeah, they sometimes they just throw random modifiers on there to see if you're paying attention to those,
Yeah, because
because
I'm
there
like,
might
why would
be,
they need? I mean, I see
yeah,
no reason why they would need it.
they could have potentially done an 86817 with a 26. So knowing that we have to have 86817, they're going to throw on that modifier to see if you're like, oh yeah, it's got a modifier. That probably is needed, type thing.
Right.
But with this one, that was two separate codes. So you didn't really have to consider that modifier and whether it's appropriate. But there could potentially be a scenario where they have the same answers. One of them just has a modifier, one of them doesn't. And you just have to determine whether or not it's appropriate.
Okay.
Because they like to trick you and make you use your brain. Okay. Number 7, a patient has partial removal of his lung, which is sent in for gross and microscopic examination. The pathologist also did gross and microscopic exam on biopsies for several lymph nodes in the patient's chest, which are placed in one container. A consultation is performed on the tissue block of single specimen intraoperatively by a frozen, sorry, I have the hiccups, by a frozen section. And the pathologist also performs a track chrome stain. So what CPT codes are we going to report for our lab tests that are performed? So for this one, we have 3 that have 88309. 2 of them have 2 units and 1 of them is a single unit. So we can still typically rule out 2 of our options with this. So that's why I'm going to use 88309 first in this one. Even though it's in 3 answers, 2 of them have different units. So 88309, this is going to be our surgical pathology. And it's got a long breakdown of how many different types of tissues can be looked at. So let's look at the question again. Okay. We have a partial removal of the lung that we're looking at. We also have gross and microscopic exams for several lymph nodes in the patient's chest. Okay. And then there's a consultation that's performed. But whenever it comes to the gross and microscopic exam for the surgical pathology, we need to figure out, are both of these for the lung and the lymph nodes located under 88309, or is it in another section? So 88309, let's go down the list and look for lung. So the lung is going to be for total lobe, I'm sorry, a total lung, a lobe of a lung, or a segment resection.
The lymph nodes
So
are in 308, 88307.
the lymph nodes, let's see,
Mm-hmm.
that is for a regional resection of lymph nodes. So be careful, because if you
Okay.
keep looking back
Okay.
underneath the 88305, you also have lymph nodes, and that's for a biopsy.
Okay.
Okay. So not only do you have to match the tissue, but sometimes, not all the time, sometimes you have to match what type of tissue it is and the reason why we are testing it. Okay. So there are some times that you're going to have, like in this case, lymph node is in 2 different levels. It's just a matter of how much of it we took, if it was a total resection or if it was a biopsy. Yep. Does that part make sense?
Okay. And it was just a biopsy, so it's
Yep.
going to be the 5.
Yep. It's going to be the 5.
Okay.
Absolutely. For the lymph nodes. Yep. The growth and microscopic exam for lymph nodes, for the biopsies of the lymph node. Yep. Okay. And then our lung, we have that partial removal of the lung, which is going to be either a lobe or a segment resection, one of the two. But because the lung is not in, well, the lung is in 88305, but it's for a transbronchial biopsy. 88307, it's for a wedge biopsy, but we're not doing biopsies, right? We're doing partial removal, which is going to be total lobe or a segment resection. So we need the 88309 for the lung.
Okay.
Does that part make sense?
Mm-hmm.
So we're not going to use the 88309 with 2 units. Okay. We don't have anything that falls under 88307 because we know that we only have 2, right? We have our biopsies on the lymph nodes and then the lung. So we
Okay.
know that neither one of those fall underneath 88307. So without even looking at the consultation portion or the rest of the codes, we
Mm-hmm.
know that B is our answer.
Yep.
Okay. But let's say we have other options that have, some of the other codes. So let's look at these other codes so that we can see what they are represented with in the question. 88313 is for a special stain, including interpretation and report. Group 2, all others, such as iron or trichrome. So we also performed that trichrome stain. So that's where your 88313 is going to come into play. And then the 88331 is your pathology during surgery. So the consultation that's performed on that tissue block of single specimen intraoperatively. And that's going to be our 88331. Okay. Any questions on that one? I know that one kind of had a lot of moving parts. And I know that your surgical pathology can be a little confusing. So just make sure that your surgical pathology, again, you're not just seeing the first one that says, oh, it's a lymph node, right? But we have to make sure that the amount of lymph nodes, we have to make sure that the reason for the lymph nodes are also stated and they match and all of that. It's not just a matter of just the tissue, because another example is if you have breast tissue, okay? So if you look, you have breast tissue in 88305, 88307, and 88309. One of them is for a biopsy not requiring microscopic evaluation, but it could also be a reduction mammoplasty. You've got 2 different breast entries. For 88307, your breast entry is for excision of a lesion requiring microscopic evaluation of surgical margins, or a mastectomy, partial or simple. And then 88309 is for your breast mastectomy with regional lymph nodes. So again, don't just stop at, oh, breast is there, that's the only one I need, right? Make sure that the intent also matches if it's stated. Okay. Any questions on that one? Okay. Number 8, in a legal hearing to determine child support, there is a dispute about the child's paternity. The court orders a paternity test and a nasal smear is taken from the plaintiff and of the child. The plaintiff is confirmed as the father of the child. So we have to do ICD-10 and CPT for this one. So I see 2 easy ways to rule out. Okay. You have 2 with the Z0281 and 2 with the Z31.448. So I'm going to go to my ICD-10 and I'm going to do my Z code, and I'm going to see which Z code it should be. So I'm just going to go out, or I'm going to go numerically first. I'm going to go Z02.81 first. So Z02.81 is for encounter for paternity testing. Pretty simple and straightforward, right? So we have ruled out A and D with the paternity test is the reason for the encounter. Okay. And then we just need to decide, is it going to be 86900 or 86910?
Technically, it'd be none of them because neither one of them because it's a nasal snare.
Hang on, I'm still flipping to it. My fingers are not moving very fast tonight. 86900 is a blood typing serologic ABO, and 86910. Oh yeah, you're right. But which one matches the closest for the testing scenario?
B.
86900 is just typing for the ABO.
The 910.
86910 says for paternity testing. Yep.
Mhm.
So if you run into a scenario like this on the exam, okay, then all you have to do is, we know that the 86900 is only telling us ABO. It's not telling us whether or not there's markers there saying that they are, genetically linked type thing. Whereas 86910 specifically states for paternity testing. So in the real world, we would not append this, right? However, from a testing perspective, even though neither one of these is truly the correct code, the 86910 is closer because it specifically states for paternity testing. Okay. So don't sit there and overthink it in the exam and say, but it shouldn't be either one. So which one do they want? Right. And then sit there and just kind of spiral and and go who knows where with it. Because I know I would definitely do that if I wasn't comfortable enough. But in this scenario, this one specifically states for the paternity testing. Yep.
Okay.
Yeah, and then Bailey's correct. So you can also narrow it down by your modifier as well.
Yes.
So because it is court ordered, then you can use the 32 because that's your mandated services. So that's just a little bit more confirmation that it should be B instead of C.
Because the 89190 is a nasal.
89. Hang on, let's look. 89. Let me flip.
190.
8, 9. I'm my eyes and my ears and my fingers are not wanting to. So yes, 89190 is a nasal test, but it's for eosinophils,
right.
not
Not paternity.
And then it even says underneath.
It even says underneath
test,
paternity tests.
Yep. Use 86910. Yep.
I'm gonna highlight that.
Yeah, I know. I don't know, but it's the wording is definitely very weird, but there's multiple things that are pointing us to that 86910. Yep. Okay. Any other questions? Sounds tricky. Okay. Number 9, we have a left breast biopsy that's performed on a mask, and the general surgeon requests a frozen section examination of the specimen to determine whether more extensive resection is appropriate. The frozen section reveals there's no indications of malignancy. No other specimen is obtained, but the remainder of the specimen or the biopsy specimen is sent for further testing and examination, including decalcification. And the results indicate breast fibrosis only. So for this one, you can use your ICD-10 to rule out as well. You have 2 of the N60.32, since we have a definitive diagnosis. So if you're not super confident and there's a lot of moving words, right? You can go to your N60.32 and at least say, I've narrowed it down a little bit. So N60.32 is fibrosclerosis of the left breast. So we do have breast fibrosclerosis, and then it is on the left breast. So we do want to use N60.32. Now, be careful, because my eyes kind of wanted to go to this one too, because it's the same numbers. It's just transposed a little bit. So we want to make sure that we're looking at the code. Oh, I did not mean to cross that out. I meant to highlight that. There we go. So we're going to rule out A and C. Okay. So 88305 is in both. 88. Nope, I was getting ready to do it again on that one too. You have 88311 and 88331 in B and D. So what I would do though is you have 88307. So we know we need 88305, but do we also need 88307? So did we do 2 separate surgical pathology tests on this one?
No.
Right. So we requested a frozen exam of the specimen, right? But then
Mm-hmm.
it says no other specimen is obtained. So that is just the 88305, right?
Yes.
And then they did send the remainder of the biopsy for further testing and exam, but that's not a separate one. So if we go look at the 88331,
That's the decalcification.
well, the 88311 is the decal.
Oh,
Yep,
yes.
I know. I know it's easy. When they've got multiple numbers that match, it's very easy to look at the wrong one.
Okay.
Your
3-3.
88331 is the pathology consultation during surgery.
Right.
So actually, I take it back. The
It's the frozen.
88331 should be the green. The 88305 should be the purple. Does that make sense? Because the 88331 is during the surgery, which is what this is, then that is going to be the green. And then the where they send the remainder of the specimen off, that's your 88305. Because that's not during surgery, that's done afterwards. And then your decalcification is going to be the 88311. Okay. Does that part make sense now?
Yeah.
Okay. I know there's a lot of moving parts in that one. I always, and I do it every single time. I switch the 2, and then as soon as I see the other code, I'm like, no, it should be the other way around. Okay. All righty. Last one, number 10. A couple has been trying to conceive for 9 months without success. Preliminary studies show that the woman ovulates and the husband's sperm count is good. A sperm sample is submitted for both a postcoital Huner test and a hamster penetration test. So how should we report it? So for this one, we have 2 that have 89300. So let's go take a look at that. That is for the semen analysis, presence and or motility of sperm, including the Huner test, and that's postcoital. So there's our Huner test. So we know we need the 89300. Again, be careful because this is 89330, not 300. And then do we need the 89320 or 89329?
The 29 has the
Hamster.
hamster penetration.
Yep, for the hamster penetration is going to be your 29. Okay. How do you feel about Path and Lab now? Are you feel a little bit better, a little bit comfortable, a little bit more comfortable?
I do.
Good.
And I know there's not that many questions on their path.
Yeah, there's really not, but it never fails that the 6 questions that they're going to ask are going to be the ones that you struggle with. Like, it just never fails. Like, and because I've taken 7 certification exams. So, and I know that I'm like, oh, there's only going to be 2 questions on that certain section. And then I go to take it, and then I'm like, of course they would pick the 2 questions that I don't have any ding dang clue about.
Well, the first certification I got was my CCA.
Oh, okay. Okay.
And that was a nightmare.
Because yeah, I've heard that one's a beast.
I mean, they tell you to bring your coding books in, and I mean, I had out of the 100 questions, maybe 10 that were coding.
That one is more what so the CPA exam, does that have a lot of like compliance and process and
yes.
and those types of things on it as well? Yeah.
Yes. Yes. Yeah. Yes.
Does it have billing information on there or no?
Yes. Yes,
it does have a lot of billing. Okay.
Yes.
I don't have any HEMA certification, so I always just kind of feel like I'm learning through everybody else what's on it.
Yeah, it's I mean, I passed it. I passed it once out of school, and I let that certification go because I wasn't using it.
Mm-hmm.
Then got a job and had to get it again, and I'm like, oh God.
Yeah.
But I passed it the second time too. So
well, good. Yeah. And you're lucky, honestly, because there's not a lot of jobs that'll take the CPA. Most of them want either the CPC or the CPS. So yeah, that's where a lot of people run into, you've got some of these schools that are like, oh yeah, your CCA is equivalent. And I'm like, but it kind of is, but it's really not.
I mean, really where the hospital that I work at, you need a CCA to work on the technical side, which would be the hospital side.
Yeah.
Where on the prophy side, which is where I work, they want the CPC.
Yep.
So it's like, oh.
So they want the CCA on the hospital, like the inpatient side versus the
Yes. And I don't understand that.
That is very interesting. That is kind of unheard of, to be totally honest. I mean,
that's what I thought.
Yeah. I'm impressed that they will take the CCA because the CCA doesn't have PCS on it, does it?
No.
Yeah, I was gonna say I didn't think so. I thought it was more like professional based and billing based versus the CCS is the inpatient. The PCS is it's a whole beast in itself.
Yeah, I no.
Yeah, no, I hear you.
Procedures.
I tried to learn PCS and I've done prophy coding for so long that my brain could not make the shift in language. And my poor brain was just mush. And I was like, you know what? I know I shouldn't give it up, but I gave it up.
I couldn't understand it. It was just,
I swear they make up their own words.
Well, they do, because I mean, some of the words for what you're looking up doesn't make sense, because it's like, I mean, like to make an incision. I mean, it's a completely different word. And it's like,
and like an excision could be an extrapolation. I'm like, what the heck is an extrapolation?
Exactly. I was like,
just say you're taking it out. Yeah.
Yeah, it
No, I
was,
know. I get it.
yeah, it was hard.
It
So,
is. Yeah. And I mean, kudos to people that do it. And, I've got a lot of people that, they are studying for it and they reach out and I'm like, oh, it'd be the blind leading the blind on that one. Cause
well, and I mean, I understand they use encoders and everything to
yeah,
do it,
yeah,
but still, I couldn't even do it with an encoder.
yeah, I know. I could barely do it when I had the answer key in front of me.
Yeah,
Yeah, it's a whole different beast in itself. And the people that can do it, like my hat is off to you and kudos
yep.
and all of the things because this girl's brain cannot comprehend it and make sense of it.
No,
So,
when I started having to do that in school when I got my degree, I'm like,
hmm
no, I'm
yeah,
not doing this in the real world. I'm not doing it.
yep,
And I
yep,
decided I wasn't going to get a job that had to do that because I couldn't do it.
exactly. Yeah, I'm like, I'm totally fine just staying on the pro fee side of things
Yep.
for sure. I've made a pretty good career out of just doing the professional coding because I hear a lot of people say, "Oh, you only have," and I'm like, no, it's not only like you don't have to have both sides of things to be a successful coder. Like there
You
are
bet.
some people that only want to be on the facility side, and that's totally fine. And there's
Yeah.
some people that only want to stay on the professional side, and that's too.
And I am happy on, the prophy side
Yep.
and doing what I do and I work from home.
Yep.
I'm happy with it.
As long as you are happy, that is all that matters at the end of the day.
I just have to pass this CPC.
You will get there, I promise.
That's
All
what
right.
everybody keeps telling me.
Yeah, I know. I know. Some days it feels like it's impossible, but that's just going to make it even sweeter and more. You're going to appreciate it more when it does happen.
Well, Monday will be my day, and I just,
It will.
third time's a charm, right?
Exactly. Monday is going to be a great day. Monday is going to be full of good news. And
I
then,
certainly hope
yep,
so.
yep.
So
We're putting it out in the universe for sure. But yeah, if you haven't done them by now, I don't know what all you've done. But do as many practice exams as you can between now and then.
I have,
Mhm.
I've done three of them already.
Okay. Okay.
I did the A, B, and C. I
Mm-hmm.
have the D, E, and F. I
Okay.
have a study session with my boss tomorrow, and
Okay.
we're going to go over some of those.
Good.
And that's kind of where we're at. I mean,
Yeah.
she has over 30 years of coding experience, and she did one of the fill in the blanks,
I know. It's
and
a whole different world.
she even got it wrong.
Yeah. Yeah. And I
So
mean, that
when
just
they
goes
do
to
go to
show that
fill
you
in the
can be
blanks,
very experienced and still, still have areas that you struggle in. And
yes.
yeah. Yeah.
So if she struggled at it after 30, with 30 years
Yeah. You kind of
experience,
don't
there's
feel
no
so
way
bad.
I could do it.
Yeah. You kind of don't feel so bad. Yeah, for sure.
I don't, and so, when they do go to the fill in the blanks, I just feel sorry for anybody that has to do it. I really do.
Yeah, I think from with us being, AAPC instructors, I think our instructors are going to get a little bit of guidance and like ways to kind of prepare students for those
Okay.
versus, just kind of like, here's a question and good luck figuring it out type thing. So hopefully, they'll give us and they've told us that they will give us ample notice as instructors so that we're able to kind of prepare our students and all of those things. So as soon as I get any word or any inkling as to how they're even going to structure it, and if there's, I mean, it could be that they're only going to do 6 or 7 questions that are fill in the blank, and the rest are going to be multiple choice. So
I
it's
mean,
not, I don't think it's going to be.
With
Yeah.
this being December 4th, chances of it happening in just January are pretty slim.
Oh, very slim. We would know by now if it was happening in January. I
Oh,
can guarantee you that.
okay. All right.
Yeah. Yeah.
Well, it makes me feel better because I have 2 vouchers. So if I do fail it on Monday, I got one more chance.
Yeah. Yeah. No, for sure. We will definitely pass along any information as soon as we get it. But one thing I do want to mention too is, and I'm sure you probably have done this before, but the day before your exam, take the day off. Don't do practice exams. Don't try to cram information because you want your brain to be rested before you take the exam.
Okay.
Because if not, you're going to go in with that brain fog and that brain fatigue. And so think of it in the way of if you go to the gym, right? If you lift for 30 days straight, eventually your body's going to shut down. You're not going
Right.
to be able to continue to build that muscle. You have to take a break day every now and then in order for your body to rest, to recoup, for that muscle to build back before you go back in. So it's the exact same thing. You don't want to study every single day and then go straight into an exam. You have to give yourself a little bit of a break to just say, okay, I've got to process the information I already know. If I cram on it last minute, I'm not going to remember it. And then you will notice that if you don't do anything the day before, your brain is going to be more refreshed on testing day and you're not going to feel so scatterbrained on the day
Okay.
itself.
Okay. Okay.
Okay.
And get a good night's sleep.
Yes, absolutely. Good night's sleep, good breakfast, all of the things that I feel like I don't have to say those things, but also at the same time, yeah. Yeah. It's that's but I feel like a lot of people don't realize that they think that, oh, if I cram everything the day before, I'm gonna remember it because I just went over it yesterday. But if your brain hasn't already absorbed that information, it's definitely not going to do it the day before. So, but
Okay.
yeah, yeah. So just take a breather on Sunday, even if it just means that I'm gonna, go watch Wicked, or I'm gonna, sit on the couch and do nothing, watch my dumb shows. Like I
Watch
have
my
shows that I have watched them 850 times, but I have a day where my brain just hurts. And I'm like, I'm just gonna go watch my dumb show. And that way I don't have to really do anything, you know, and then I'll always feel
it's
better the
football
next day.
Sunday, so
There you go. Yep. Football Sunday, sit and watch football and take your mind off of it for sure.
right.
Yep.
So
All right, guys. Well, if you all need anything in the next week, let me know. And if not, then I will talk to you guys next Wednesday.
Hi, Tiffany. I have question.
Yeah.
Actually, this is my first time to join. I am so happy. I'm glad that I found this group because I actually took my practice exam last October,
Hmm.
and I really, really hard time to because I don't know about the process of elimination, and I took my practice exam many times in order for me to pass, and then 3 weeks ago I found this video. I'm so blessed and I'm glad that how to process of elimination.
Yeah.
And my question is, I heard a discussion a discussion uh of your of the topic, and few videos that because I mean, they gave me my practice exam like 4, 5, and 6, and it's really very hard. So
Okay.
my question is, they gave me this hard question, practice exam question. So my question is, they will give me also the hard or difficult uh, CPC examination, or is it
Are
is
you
it
talking about the AAPC practice exams that are numbered
yeah,
4, 5, and 6? So
yes,
those are honestly, those are the most difficult practice exams that AAPC
yeah,
gets. Okay.
yeah.
So you probably will not have your entire exam at that level of difficulty. If you're
Okay.
wanting a better idea of how the exam is going to be structured, then I would purchase the A, B, and C package from AAPC, and
Oh.
that will give you a better, I guess, like a gauge of kind of like how the questions might be worded as far as
Mhm.
difficulty.
Yeah, because the medical terminology, I don't have any idea. They asked me about the medical terminology about the
Hmm.
eyes, and I
Yeah.
don't know. I didn't
Yeah,
even hear
yeah,
the
and
word.
that's the thing with med term is it literally can be anything in the body. So I do have out on YouTube. If you go to medical coding legacy education,
Mhm.
then there is a playlist for medical terminology and anatomy out there that you can go out and listen to. And it's broken down by body section. I think the longest video is maybe like 30 minutes. And I think that's cardio. But you can go through those medical terminology and anatomy videos and kind of get a better understanding overall of the med term and anatomy.
Is it in YouTube?
Say that again.
How can I find that video? Is it in YouTube?
It's on YouTube. Yeah. If you go to the
Okay.
Legacy Education YouTube
Okay.
channel,
Mm-hmm.
then there's a playlist for medical terminology and anatomy.
Gotcha.
I think Richard actually just put it in the chat.
Yep.
Perfect. Thank you.
Okay. I really, I don't know. I was just cramming and I did not get it, and I took it again and again. I think three times in each number, and oh my God, and I
Yeah.
have no
Yeah. The
idea.
4, 5, and 6, I'm surprised that those are the ones that they gave you. But 4, 5, and 6 are the most difficult practice exams. So don't feel bad that you didn't get those because I probably wouldn't even be able to get them all either. But yes, 4, 5, and 6 are going to be the most difficult. If you want ones that are going to be more representative of the questions that you'll see on the exam, I would get the A, B, and C.
Gotcha.
Okay.
Okay.
Do
Yeah.
you get your questions from there? I mean, the questions that you've made up, or
These questions are not from like the practice exams from AAPC, but
okay?
with us being an AAPC licensed educator, we
Mm-hmm.
get it like a test bank. I think we've got like over 800 questions, and that's
Okay.
where these questions come from. So they are written by AAPC. Yeah.
Now the practice exams that you can get from the AAPC, the
Hmm.
ABC and D&E, and all those,
Hmm.
are some of those questions actually on the test?
It's possible. I
Okay.
can't say for sure because it's all going to depend on the version of the exam that you get.
Right. Yeah, because you get a
But
different
I
version
have
every.
also had students that have told me that some of the questions that we go over in the test banks, if it's not the question, it is a question that is very similar.
Because
Um,
I
yeah,
did have a few similar ones.
yeah,
That's why
yeah.
I was
So it's
questioning
very
them.
possible. Yeah, it's
Okay.
very possible that these questions could mimic, if not be exactly, but obviously that's not a guarantee.
Right.
Yeah,
Okay.
yeah.
Okay.
Good question.
So okay, well, thank you.
Yeah, absolutely.
I will definitely be on next Wednesday, at least to let you know whether or not I passed or failed.
Yeah. Yeah. If you well, and let me know before then. If you want to shoot me a message, then I'm happy
Okay.
to celebrate with you. Or if not, I'm happy to give you some advice on how to move forward too.
Okay.
But
All right.
I'm putting it out there that we're going to be celebrating.
I certainly hope so.
All
I do
right,
hope so.
guys.
So, all
Well,
right.
good
Thank you
luck.
very
Good
much.
luck, Lisa, on Monday. If anybody has any questions or anything before then, don't hesitate to reach out. Okay.
Okay. Thanks.
You're
Thank you.
welcome. Bye bye.
Bye-bye.
Yeah.